And I've been wanting to start bringing in.
Well, they can't file papers till 6 months before. But, yeah, keep it. So, that's that. And like the judge was gonna have to.
First church, we don't have any more after.
We can move over too. Yeah, we're just spreading.
All right, we're moving on.
You betcha.
It's 5:30. I'll go ahead and call the meeting to order. If you could rise if you can for the pledge of allegiance.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Mrs. George, you have the roll?
Yes, I'm good.
Okay. Item number 2, adopt the agenda. Are there any changes to tonight's agenda?
Don't have any other items?
Is that entertain a motion to approve?
So moved.
Second?
A motion and second to adopt the agenda. All in favor say aye. Aye. Opposed? Motion carried. Communications, public participation on non-agenda items. So if there's anyone here who would like to speak on anything not related to the mask mandate, now would be your time. Sorry, mask requirement. No, okay, we'll keep that for public input during new business. Moving on to reports.
None for me.
Have anything under old business?
Nope.
Okay, so moving on to new business. Item A, consider mask requirement and social distancing strategies for students and staff in grades preschool through the 12th grade. So here's how I'd like to do this. We'll have Mr. Jorth give his report on current status here at the school, along with some other districts, to talk about the memo he gave us here tonight. We'll have Mr. Holm speak. Then we will ask CLEA for their input on the staff survey. After that, we'll take some public input, and then we'll transition over to board discussion, and we'll give everybody more on that when we get there. So, Pat, Mr. Jorth?
Yeah, so I included a memo for everybody at your table. My recommendation continues to be to continue the mask requirement for students preschool through 12 when they're unable to socially distance through the end of the school year, and then also require that masks be worn in the hallways, lunch lines, and common areas, with those exceptions during PE, band, recess, athletics, or while eating and drinking. Just compiled some of our current data. So Lyon County positivity rate right now, 4.2% over the last 7 days, 3.4% over the last 14. In our building itself, we currently have 0 students positive, 0 staff members positive. We only have 1 student in the entire school that's currently under quarantine, and that was due to a close contact outside school. Since January 1st, we've had 5 students who have tested positive and an additional 5 staff members. I didn't count up all the individuals that have had to quarantine, but since the first of the year, that's how many we've had. The last student, April 8th, so the beginning of this month, and the last staff member, beginning of February. So that's where we're at currently with the virus within the school and within our community. Vaccination update, 82 staff members have been vaccinated by Health Services of Lyon County. Now there could be a few more that were vaccinated outside of Lyon County. Maybe they went to Hy-Vee, or they went to, their place of business might have, if they were working a second job, might have gotten vaccinated elsewhere. But that's 66% of our staff members, and they're all beyond the 14-day kind of window post the second vaccine. In addition, had a conference meeting yesterday, so I've updated where everybody else in the Siouxland Conference is with their current mask requirement. Basically, Lyon County and in addition with Sibley, Oshedon, and Okoboji continue their mask requirements, whether it's just for high school students or whether it's for all students. Sioux County schools plus Sheldon have transitioned to strongly encourage students and staff to wear masks while in the building. In addition to that, I'll tell you that West Lyon's having a special meeting tonight to have the same conversation. But again, I'll just kind of reiterate, my position is continue to require masks until the end of the school year for all students and staff. Before I hand it off to Craig, I did yesterday forward you an email from Melissa Stilson. She's unable to be here tonight because they are doing a vaccination clinic. They did have a kind of a statewide public health meeting yesterday. And so, she continues to recommend that students and staff wear masks when unable to socially distance. Lyon County will continue to do contact tracing and follow the quarantine guidelines. And that's the guidelines from the Iowa Department of Public Health. So, anything that I can answer questions about for the board? Okay, Craig?
Good evening, everyone, and thanks for the invitation to be here with you tonight. The school administration's recommendation closely aligns with the CDC's recommended mitigation measures for schools. In conversations this week with public health and local healthcare providers, the recommendation we would have is to follow the school administration's recommendation and keep the current mask policy in place through the end of the current school year. Across the region, we've seen a trend of younger people being confirmed positive with COVID-19. The variants that are circulating within the United States and within Iowa are more transmissible than the original strain of COVID-19 by 30 to 50%. There is evidence to suggest that these variants impact younger individuals more than the original strain of COVID-19 as well. Across the state of Iowa, 24% of new COVID-19 cases are in people between the ages of 18 to 29, which is significantly lower than we've seen in the past. In Lyon County, that's 27% for that same age range. Removing mitigation measures would very likely increase the spread of the virus in our area and in the state. Given this trend and the success of the current masking policy that is in place and keeping kids in school and reducing quarantine needs, it's the recommendation that the school continue with the current mask policy. This will help ensure a safe and positive end to the current school year. Now is not the time to back away from guidelines that have been working as intended. Thank you. I'm certainly happy to answer any questions that come up as well.
Questions for Mr. Holmes? Okay, thank you. CLEA survey results.
This survey was out from April 1 through April 7, so it's a little out of date. We haven't done one recently. The question was, what direction would you like to see the district take with the mask mandate? And again, this was put out on April 1st. 49 people answered, by the way. The first one, end the mask mandate, was at 69%. Leave the mask mandate as is was at 14%. And wait until May 1 was at 16%. Because that's right when we were getting vaccinated, so. And then there was a question just for TK through 6 teachers, asking if they feel it's appropriate and safe to have students eating in the lunchroom. And 88% replied yes and 12% replied no. And we didn't have a comment section, so.
Any questions from board members on that survey? Okay, we'll move on to public input. I know we had at least one person signed up to speak tonight, Mrs. McMahon. Is there anybody else in the room that would like to give public input? No. Okay, welcome, Mrs. McMahon. You have 5 minutes, and the floor is yours.
Well, as I said, I'm Annie. I currently have 3 students that are here at Central Lyon. And I first want to start off by thanking all of you for serving during what has been an impossible year. COVID has thrown our lives and our community upside down, and it's granted each of us an opportunity to reevaluate our priorities. Our family has consistently prioritized taking actions that protect ourselves as well as those around us. We have quarantined and masked and isolated, all according to CDC recommendations, this entire year, and we will continue doing so. We started this year off doing distance learning at home, and then since masks were implemented school-wide, Josie and Noah did return to the classroom, and I am still distance learning with my kindergartner. A change in the mask policy tonight would force me to take Josie and Noah back to distance learning. COVID is still not under control and continues to change in unpredictable ways. Unfortunately, there's much we do not know. We don't know when students will be able to be vaccinated. We don't know if those who have had COVID will possibly have lifelong health conditions. But we do know effective preventative measures. We know that masks help prevent the spread of COVID, especially when there's high compliance. We know that physical distancing helps. We know that practicing good hand hygiene helps. And we do know that if you're 16 and over, vaccination helps. Considering that students in preschool through early high school are still ineligible for vaccination, masking is still a critically important preventative measure that keeps them as safe as possible, especially when they're indoors. Just yesterday, CDC updated their mask guidelines, and it is clear that the safest approach right now is to maintain mask policies indoors, regardless of being fully vaccinated or not. We are not health professionals, let alone contagious disease specialists, so let's leave the medical decisions to those who have spent countless hours in the immunology and contagious disease field and listen to their recommendations. There is evidence, as Craig was mentioning, that suggests that there's a variant that is highly susceptible more to children. I won't go further into that since Craig covered it well. I'm sure you also all heard the awful news that a first grader in Marshall passed away from COVID. I acknowledge that death in children is very rare, but it's unacceptable when simple and effective preventative measures such as masking are available. Looking at Iowa's COVID website, Lyon County currently only has 28% of its residents that are either fully or partially vaccinated, which is nowhere near the recommended 70 to 80% to achieve local herd immunity. Even when we include the 1,500 positive cases in our county, assuming that there's no overlap, that means at most 41% of our county has antibodies. This still leaves members in our county and community at risk. Maintaining a mask policy could help prevent further infections. I'm in a privileged position that allows me to choose to distance learn for our family, but many in our community don't have that option. We are all relying on this administration to make the best decision. This year has been challenging for all of us, and I'm exhausted from saying no to my kids. No, we can't go to large family gatherings. No, we can't do sports this year. No, you can't sing in your choir concert anymore since masks are not required. I don't want to say no to coming to school in person again. I'll simply close by urging each of you to extend the current policies until the end of the school year. It is working. Why make a change for only 3 weeks? The students have done a great job, and it is your responsibility as the adults to keep them safe. Let's keep moving forward by doing everything we can do to prevent the spread of this predictable virus among our students and our community. Thank you.
Thank you. Okay, so we will close public input on that item and move into board discussion. So the way I'd like to handle this is each board member should be allowed to speak once before anybody speaks again. And that board member can say what they need to on the topic if they wish to. Once that is done, I think we should take a broad motion, or whatever that may be, on what we want to continue or not continue moving forward. Once we have a motion and second on that, then we'll go ahead and use the amendment process and let other folks around the table who may have some different ideas, and I'll bring those forward. Just a reminder on the Roberts rules, like I mentioned last time, a motion is generally for supporting an item. If you second an item, it doesn't necessarily mean that you support it, but that you believe it should come to a vote of us board members. So with that in mind, I guess I'll open it up.
So is everybody going to just be, are we going to have an open discussion right away? Is everybody going to talk, or how do you want to do that anyway?
Everybody will get the chance to talk before I would entertain a motion.
Right. I'll start. I've obviously been, haven't been shy about saying that I'm not in favor of continuing with the mask mandate. And I'll start by saying, you know, with where our numbers are at county-wide, and being out in the public with prom and FFA banquets and other activities, and not just school-related, but being out in public, I see very little masks being worn. And I realize that our students aren't able to be vaccinated yet at this point in time, but they are also on a smaller scale of contacting or contracting this virus as well. The contact tracing, I guess, and I've got some questions that you guys can answer. The contact tracing, are we required as a school to do contact tracing?
So the public health is responsible for the contact tracing.
Okay,
And so because our nurse is also employed by public health, that's where we are unique in the entire state. So our nurse and our principals are ultimately the ones that investigate those close contacts when they happen here at school.
if they happen at school, but if they happen outside of school, then what happens?
Melissa Stilson or whomever from the public health will
Okay.
conduct those interviews and investigations.
So if a student, obviously nobody knows when they get the virus, but if a student goes and tests and they test positive,
Yep.
what are the steps that happen at that point in time? Is our nurse required then to figure out who she was in close contact with, and how is that possible?
Yep, so if, currently the way it exists is if we're notified here at school that somebody has tested positive, then the nurse and the principal that student, whatever grade level they're in, would investigate that claim.
So are our desks 6 feet apart in the classroom for the most part?
In a majority of the classrooms, but like Mr. Allen's science classroom with the lab tables, we can't get 6 feet social distance there. There's some elementary classrooms where there's tables instead of individual desks, where again, we can't guarantee 6 feet of social distance in those classrooms.
And are they wearing masks in those cases?
Yep.
So even if we eliminate contact tracing at a board level, it's still required because we have public health.
Right, so Lyon County is going to continue to contact trace and follow the guidelines of the Iowa Department of Public Health. And that's why I mentioned Sioux County in my conversations with other superintendents. Sioux County is the only county that's not following that guideline anymore. At least in our conference. I don't know other parts of the,
Contact tracing.
correct.
And that's driven by Department of Public Health, not the school.
Right, so those public health institutions in those schools within the Sioux County have chosen not to follow through on the contact tracing. But Lyon County will continue to do that, just like O'Brien and Osceola County and Dickinson County, where Okoboji, Sibley, Oshiden are.
So we don't have the choice per se of whether we want to do contact tracing. That's driven by Melissa and Public Health.
Correct.
Correct.
Yep. So if, one of the reasons we put the mask requirement in the first place was mask to mask, 2 students wearing mask. That was an exception to having to quarantine. If we were to go to, strongly encourage the wearing of masks, then Brenda and the principals would basically have to work with teachers for each period of the day to see who's been wearing a mask and who hasn't been wearing a mask, to conduct those investigations and to identify exactly how many students that would impact, that would ultimately have to quarantine for 7 days or 10 days, depending upon if they got tested or didn't get tested.
Can I interrupt here a second, Scott?
Mhm.
So, are you telling me that Lyon County Health can do whatever they want on school grounds?
I'm saying we continue to follow the contact tracing guidelines from public health.
Right. But that's not required. If this governing body decides contact tracing tonight is done at the school, it stops.
If that's the
At the
decision,
school.
if that's the decision of the board, we make our own
I
policies here.
think that's what Scott was getting at,
Okay,
right?
yes, correct.
Yeah, that we have that option.
If we have that option, if we say, we don't want to do contact tracing at school, Lyon County can still do contact tracing, but Brenda doesn't, the principals don't have to go around and figure out who was in close contact. That would be a possibility, correct?
If that's the policy that the board wants to make tonight, that we're no longer gonna do that, then that's what we will enforce. I just know that relationship that we have with Lyon County is gonna put us in a unique situation for the last 3.5 weeks of the school year with our nurse and our relationship with public health.
Is it your opinion that they're going to stop coming to school?
No, I think they're gonna continue to, but I don't know what that contract might look like for us when we, look at next year's nursing services with public health.
So maybe this is a question for you, Craig and Butcher. When does the quarantining end then? You look at our numbers with our positivity rate, and they continually go down. When does quarantine end?
Nobody knows the answer to that question at this point. Remember, we're still in a period of time that is considered a pandemic at all levels, local, federal, local, state, federal levels. And these efforts that are there to quarantine, contact trace, are all best practices designed so that public health, healthcare providers have an understanding of what's happening regarding the details of the pandemic and the disease that is trying to be understood, studied, treated as a part of the pandemic that exists. Remember, this pandemic is a little over a year old. So from a disease perspective, it's very, very young. And the challenge that we have is it is still spreading within our country and globally in drastic ways. And so variants will continue to develop so long as the virus is able to spread.
So what stops it from spreading?
Quarantine, mitigation measures that we've all talked about, vaccination, all the things that we've been doing for the past year are the things that prevent the spread of this disease, that slow it down, prevent variants from developing, so that then at some point, an unknown point, you can get a handle on it and it can be declared not a pandemic anymore. but we've not gotten to that point.
Isn't a virus, there's no way to stop a virus, is there? Meaning, we have the flu every year, different strains, we're not doing all this for the flu.
You would,
What's the difference?
if I can interject, the state does have, again, public health guidelines say that if we get to a 10% absenteeism rate, we have to begin reporting that to the state and work with them about, again, closure, distance learning, stuff like that. Granted, we haven't been close to that since November, right? When we originally put the mask requirement in for all grade levels. And so, to answer your question specifically about the flu or any other virus that might come in the future, that would be the same kind of strategies that would be used in that event.
If somebody gets sick, and, I mean, obviously, you're not putting timelines on that, and I get that it's difficult to do, but we're gonna have to deal with this for a long time. So when does herd immunity actually come into play? Because aren't there a lot of states that have been in lockdown that are starting to open up, and aren't their numbers skyrocketing? Haven't we already seen that skyrocket, and now we're on the downhill slide? So couldn't it technically be said that herd immunity is already here, even though 25% of the population in Lyon County is, I mean, with everything going on?
Herd immunity happens when 70 to 80% of the population has essentially immunity towards a particular disease. We're at, as was pointed out earlier, we're at somewhere between 30 and 40%.
But that's just people vaccinated, correct? But if I had it, I already have the antibodies in me. Isn't that part of herd immunity too?
It is. The challenging part about that is natural immunity wanes over time, and so it actually decreases over time. So it's difficult to say you've had it, now you're immune forever, because that's not the case. We've seen reinfections happen pretty significantly. And the other part that you have to consider is, as these variants are developed, your original immunity, or not yours, but a person who was infected with the original COVID-19 virus, a new strain of that, or a new variant, they have immunity towards one strain, not the new strains.
Will I have to be tested for the rest of my life for COVID? If I get sick and I have to go to the doctor?
All depends on how it goes. Some of these are kind of impossible questions to ask, given the newness of the virus that we have. We don't know the answer to that yet.
I guess my point of being this is, like we've been dealing with this for 14 months, and I know there's new strains coming out, but it seems like as more and more information comes out, there's some things that we've done in the past that maybe didn't have to be done, that at some point in time, I think we have to get back to a normal life. And I think with the vaccine, 66 or 82 staff members have had the vaccine. With the vaccine out there, with people fully being vaccinated, and with kids being at the lower spectrum of those that are actually getting positive rates. And I know that there's new strains, but we've had information after information from the original strain that, we had to protect the kids. Well, then it comes out that they're not as infected or infectious with the original strain. So I don't know, we keep putting all these measures in place for something that we don't know a lot of. And when I go out in public and I see these kids, the chance of them getting the virus at school, I think, is slim to none, because they wear their mask here, and I think they wear their mask, but a lot of times it's down around their chin, or they're touching it, and then they get their hands go to their face like that, and then they don't sanitize. And I know we got to do a better job at that, but it gets on all of these surfaces. And so I think wearing the mask has been a part of it, but I don't think it's the whole part as to why our rate of, 5 kids since January 1. The disease is out there, and these kids are leaving the school, and they're taking their masks off instantly outside, and they're congregating together. We were taking pictures for prom at the courthouse. Nobody's wearing a mask, and I don't think we've had a big jump in it. So I just think that there's a lot of, I'm kind of rambling on here, and I apologize for that. But with where we're at with the data, with 3.4% of positivity rates, the fact that I know we've had the mask, but I don't think that it's been, and this isn't my soapbox, I don't want to get on here and all of a sudden say that, they're kids, I get that, and we can't be on them constantly that they gotta wear a mask, they're gonna be taking it off. And I think that happens, and I don't want all of a sudden tomorrow, all these kids are coming to school and it's like, wear your mask, wear your mask, wear your mask. Like I think I made the comment the last time that it happened. But these kids gotta be able to finish, I think, on a positive note, because right now what you're telling me that there's a chance that if we keep this mask mandate in place, we're gonna start the school year with it next year. Because there's so much unknown. And there's so many other schools I had contact with, not direct contact, but it was from a House of Representatives that is working with West Lyon, and he's working with Sioux Center about the whole mask mandate, and he's not a believer in the mask mandate, and that there's so much misinformation that I think we're getting, there's so many schools out there that aren't doing either. They're not doing the contact tracing, they're not wearing a mask mandate or anything like that, and they've been fine. So for us to continue with this whole mask policy when our rates have been so low, those that want to be vaccinated have been vaccinated. I think contact tracing has to be done at the county level. And those that want to wear a mask, I'm not saying that we have to eliminate the mask altogether. If you want to wear a mask, there's nothing wrong with wearing a mask. Wear it. If you want that protection, wear the mask. But when the data suggests it, and we've got so many kids that aren't already following it outside of these 4 walls or these walls, I don't see a spike that's going to happen because we take the mask mandate off in school because it's not happening anywhere else. Sorry, I'm done.
No worries, no worries. Anybody else?
I guess I'd like to share today, well, first of all, this week, I asked Mr. Dorth a bunch of questions, and yesterday I reached out to our principals about coming to visit the school. I wanted to know what it's like as a student in Central Lyon wearing a mask, if I'm in elementary or high school. What's that looking like now? So I came to the school today, and I observed. I talked to Jason and Steve, and I talked to the nurse, and I worry about the COVID virus is one thing that we all have to be concerned about. It is a real thing, and so we have to be concerned about it. But there's also other factors with kids that probably some parents are noticing, teachers are noticing, that this starts to affect them socially and emotionally, and they're tired of it and they're not understanding it. And I think especially when it comes to in the hallways, that's a measure that we put in place that went above and beyond the quarantine guidelines, because if you're in the hallways, that's less than 15 minutes. And so that's something that we put in place, and I'm glad that we did, to help slow that spread, because our positivity rates were high. And as Scott and as has been presented to us, our rates are not where they were at all. They are low. And so that measure, that reason for having masks in the hallways, I have a hard time understanding why we need to still continue with that. That's not part of when we do close contact. It's kind of that wouldn't matter. If we remove that, there's still no close contact quarantine issues with that. I looked at the classrooms. Our classrooms are socially distanced. There's, like Mr. George said, there's a few that can't be, and so they wear masks in those classrooms. And that maybe still needs to be in place so that we don't have a student that has to quarantine and not go to a field trip and not go to graduation, not go to any other school activity. But I worry about transmission, but I feel like we've got that under control. So I feel like it's good here. Maybe it will spike up and we'll have to make another decision at a later date, but we have to kind of live in our moment right now. And I have a hard time understanding why we would still need those kids there. It's hard on them. I watched them in the hallways. If some wear their masks, some do it all the time. Some have a hard time with it. Some of them, even when we really needed to wear them because of the positivity rate, they wore them because they knew they had to for themselves and for the people next to them. But it's hard for them to do that now. It causes a lot of different issues with people. Some it's easy. Some people it's just an easy choice, do it all the time, no questions asked. That's just not everybody, and we can't expect that from everybody. So I support keeping the mask when you can't socially distance in a classroom. But when we're in those situations where we, in the hallways and passing, teachers are exhausted, and the other thing that's happening is they're losing their relationships with their kids because of this, with their students. It's hard on teachers to have to, every 45 or 50 minutes between classes, get after kids that they like and respect, and they want those kids to respect them. It's hard on those teachers. They don't enjoy that part of their job at all. And I don't want to have them to continue to do that. Just like Scott said, I want our kids to leave school on a positive note. And it's hard for them too when they see a lot of area schools go away with the mask. It's hard for them to understand why we do. And the reason why we do is because our county is still contact tracing. So that's why we need that small piece to it. But that's, I guess,
But the
what
county can still contact trace.
what?
The county can still contact
Yes,
trace.
yes.
We just
And
don't
we
have to
can
do it
still
easy
help
else.
with that by, in our classrooms, wear those masks when you can't socially distance. And that 15 minutes and 6 feet apart. So that was my observation in my research and looking into things. That's how, kind of where I stand.
I agree with you, Carrie, and one of the things too, I think it's difficult for our teachers and our staff to enforce this issue with the mask. Like you said, they're constantly telling these kids, and it's probably a lot of the same kids, I get it, but these kids don't do it because there's no consequences. The consequence, I guess, is if they would contact the virus, and I don't want to put, I don't want to put any consequences in place on these kids by any means. I heard detention and suspension being thrown around a couple of weeks ago, and that is so far from what we need to do with this whole virus if somebody's not wearing a mask. I don't want to go to that point at all, but it's tough for our staff to be able to enforce it when there is no consequences. And I don't think there should be consequences of missing a sporting event or a concert or having to sit in detention or being suspended.
And my understanding is that the kids, and I think the elementary, they're pretty good about it. They, their teachers tell them to do something, and they will do it, and they are very good about it. As you get older, you start to think for yourselves, and we want independent thinkers. And they start thinking for themselves, they understand the world around us, And it's hard for them. And like you said, it's hard to enforce that, and a serious consequence on that is hard. And they're just, it's hard for them and hard for teachers.
So maybe a question for the principals, where, I understand the science rooms and a few other classrooms were not able to socially distance. Help me better understand where we are not able to socially distance currently, so that if we said we're going to relax the mask requirement, where would those kids still be at risk of being considered a close contact if they were not wearing a mask? So my understanding is the lower elementary grades in particular, is that correct, or for the most part, are they able to socially distance 6 feet apart?
Most of the classrooms have eliminated a lot of the unnecessary or the tables and things that are not used. So they have desks that are or very close to putting 2 at a table, which is very close to the 6 feet if not. The carpet time, that's when they bring them into a large group. My observation is that most, if not all, use mats at those times when they're sitting on the floor, even though it may not be a 15-minute time. Most times those carpet times are not 15-minute times.
And I think I've heard, and maybe this may or may not be true, but I've heard that they try to, even though they may be wearing masks, they try to limit it to not more than 15 minutes.
Right. And for those kids, we're building stamina, but that's the biggest thing we're seeing is those kids don't have that stamina for that time span on the carpet. 15 minutes in that one area. So they do that as a large group and then they break into smaller groups and move around. As far as my end, we're very compliant because the kids will just do what we ask. And I know that's not school, it's harder as the kids get older. Like in middle school, I say mask up please quite a few times in the day, which is understandable. You know, when you get to high school, it's a lot different, but you know, in the lower elementary, it's pretty easy to accomplish either wearing the mask for everyone or getting to 6 feet apart.
Okay. Okay, thank you for that. So for me, one of the main reasons why it made sense to implement the mask requirement that we did back in whenever it was because of the change of the requirement to quarantine if both parties were wearing a mask. To me, that was the game changer, so to speak. So that's why I thought it made sense to have the mask requirement in place where not able to socially distance. And I still think it does make sense to do that where you're not able to socially distance. And most places we are able to. There's some exceptions, yes. But in most places it sounds like we're able to do that. So for me, the biggest issue is in addition to just the spread of the virus, which certainly is much less than it has been or was in the past. So I think that risk is much less than it was. So that maybe plays into part of the decision overall for me. But the bigger issue for me yet is the close contacts. If we get rid of masks altogether, I think you're going to have potential at least for more close contacts and more kids out of school and not learning when we want them to be in school, missing an event, a track meet, graduation, a field trip, whatever it is. And I would hate to see that happen. We've gotten this far. We're within 3.5 weeks of the end of the school year. Yep, it's getting tiresome to do it. I get it. I understand that. But I think in those cases, in my feeling at least is, in those cases where we're still not able to socially distance, it still makes sense to wear a mask. I would be okay with, again, Carrie, as you alluded to, passing in the hallways and the common areas, as long as you're not together in a group or with another person for more than 15 minutes, you're not subject to quarantining and the contact tracing in those instances. So my feeling at least is I'd be okay with loosening that requirement in the hallways and the passing areas. And I would listen to arguments for getting rid of or being able to go back to the lunchroom and eat lunch in the lunchrooms or other places where it may make sense. So that's kind of where I'm at. If there's individual places where it makes sense to not require masks, even if they are not able to socially distance. I'm certainly willing to listen to that, but at this point, the only place that my opinion is, it makes sense, I would be open to relaxing the mask requirement would be in the hallways primarily.
Question for with where they're not able to socially distance, like in Mr. Allen's science class, is it our responsibility to make sure these kids always mask up, or doesn't some of that have to fall back on the students and the parents? You know, if you don't want to miss out on graduation, you don't want to miss that sporting event, shouldn't they be saying, you gotta put a mask on? Do we have to require that? Can't part of those decisions be made back by the parents?
There,
Opinion?
but the one thing I could say to that is not, it's kind of an all or nothing. It's hard for me to go with that because you might have kids that aren't in activities and they don't care at all. And if I'm next to that person and I'm in activities, then.
And I'm wearing a mask.
And I'm wearing a mask, it's not gonna matter.
Right.
Good point.
So.
To me, that's the
Yeah.
difference. If one is and one is
I
not.
agree with parent choice, I really,
I
really
do
do.
too. I do too.
But I really think that in a school setting and with the contact tracing from our public health, that there has to be just a little bit of governing there. Unfortunately, I guess. Because I really do believe in.
And if there was one parent or child that decided not to wear a mask and they became the positive tester, and now all of a sudden they infect or close contacts to other kids that even if they do choose to wear a mask or do wear a mask, there's still that close contact.
Yeah.
I mean, so to me, again, the difference maker was if both parties are wearing a mask, it's not considered a close contact. To me, that was the difference maker.
But that decision, the quarantining decision is made by an outside entity. That's not made by us.
Agreed.
But
I
our
have
nurse
a
is
problem.
part of that entity.
She is, but she works within our grounds.
Yeah.
And we should have the ability to say what we want to happen in our school grounds. And I guess, Dave, are you good?
And we can miscomment on that though, Andy. We can, but that doesn't mean that Melissa is not going to still do contact tracing.
Outside the school.
But she can even come into the school and say,
She
okay,
can.
Jimmy, were you in close contact? But through the interview process,
Do you put
she can
Brenda-
find that information
do you
out.
put the nurse in a difficult spot, Phil, by saying that? Because she has to choose between us and public health, Melissa.
There's no choice to make. If the board here sets a policy, that's the policy. It doesn't matter who you work for. It doesn't matter, me coming in here as Joel, member of the public, I'm required to wear a mask. I don't get to make my own rules and impart them on everybody else. I'm not saying I'm for that, but I'm just saying that has to be part of the discussion that we're having here tonight, is that how long are we gonna hold on for that? And, can I go? Okay? Okay. So, one of the things that our board has always said that we were gonna do is that we were gonna make decisions that were data-driven. And in the past, the last time we met to really talk about this issue in depth, November 19th, 2020, it was in what I would call a different time. We had no vaccine, our positivity rate was skyrocketing at the time, it was around 35%. We had students out, we had staff out. We had problems finding substitute teachers, and we were worried that there were going to be points when we had to send a couple grades just to all online learning because we didn't have staff. We had a bunch of people sick in town. Our hospital had staff that was sick. The hospital was filling up, and we were getting close to dire straits there. But our board acted, and we put those requirements in place. And I like to think that what we did helped curb the spread, and we did our good duty there. Now, when we come to tonight, we have a vaccine that for those that are vulnerable are those with pre-existing conditions. They've been able to have it, and they've been able to get within their 14-day window, as Mr. Jorth had alluded to with staff. Our 7-day positivity rate, as Mr. Jorth put in his memo, is right around 4%. Well, one thing I feel that has changed between November and where we are today is that the conversation has changed nationally, mainly by the media. It's no longer about we need to protect those vulnerable and those with pre-existing conditions. It's changed into we got to protect everyone so they can't get COVID. And that is never going to happen. COVID is going to be here, and I have no idea, I don't have a crystal ball, when it's going to be fully eradicated. The handcuff to me is the whole quarantining issue. The data that we have on the positivity rates, how many kids have been sick, that screams to me that we don't need to be wearing masks at school. So we are letting an outside entity tell us when that is okay. So to me, I'm not sure that's a good enough reason. What I mean by that is, what's our conversation going to look like if Lyon County Public Health hasn't changed their stance come August? And they say, sorry, we're still quarantining within the school. Maybe we haven't had any cases since that time. At that point, are we going to say, well, okay, enough's enough, we're going to do something here on our own? I want to have the discussion of how much are we willing to tag along with Lyon County Public Health to make those decisions for us. Because that's ultimately what we're all talking about is the quarantine issue. We don't want anyone to miss graduation, a sporting event, or anything else because they weren't wearing a mask. And that all comes down to quarantine, which is not something the board put into place, but something that county health put into place. So that's where I'm at. I just feel really handcuffed by the whole quarantining issue. I don't know if there's a good answer there, other than the board saying that we're not interested in having county do any more contact tracing in here. But I think Scott hit the nail on the head that what's the trigger? What is the trigger for us? What's the data point that says we're not going to wear masks anymore? Our community is done with it. They're not wearing masks anymore. They did the good deed back in November when things were skyrocketing and enough people wore a mask around that we were able to calm things down around here. But when I go to my daughter's track meets, volleyball meets, nobody's wearing masks anymore. So I get the benefits of it. I'm a supporter of mask wearing when the data says we need to do that. But the data to me right now doesn't say that we need to be wearing them, and this is why I started the conversation with Mr. Jorth back in February. That, okay, our numbers are going way down. Do we need to talk about the preschool through 4th grade mask requirement? How's that teaching going with them? Are they feeling constrained about that? As Mr. Jorth mentioned, they've gotten along and did a great job handling that mask requirement, both students and staff. So that's just kind of where I'm at. That with some things that happened this summer, with some other extracurricular activities, I'm not real fond of having other organizations control what happens to our students. So I'll leave it at that.
So Andy, are you suggesting that we would, so currently what happens is if there is contact tracing that goes on, so our nurse, Brenda, does that, works with Melissa, I'm assuming, to get to understand who is the person that tested positive and then who are the close contacts. And then she works with the principals to help understand that information. Who are the close contacts?
Yep.
So are you saying, Andy, that we would say, principals, you are not to work with Brenda to get that information?
I'm saying that unless we're going to ride with Lyon County Health until the end, then that's what we're going to have to do. Because what's the trigger for Lyon County Health to say, What's the trigger for them to say no more quarantine? Nobody has a good answer for that. Right?
Right, I mean, it's probably out of, maybe it is, maybe it isn't out of Melissa's hands, but it mainly, I think, would be driven from the state. From the state
Although
Department of
counties
Public.
obviously can make that choice.
Well,
because
apparently in
counties-
Sioux County, they have made that choice.
And I don't
maybe
know
it's
what
just,
other
and maybe it's
counties.
countywide, they're not doing any contact tracing?
Yeah, from the representative, what he had emailed, and he had a second hand, he said contact tracing, there's no law that you have to contact trace. You know, there's no requirement, and quite honestly, he said, you know, there's no penalties for not contact tracing.
There's no laws or penalties for not quarantining either.
Right.
So it's kind of like us here at school, we've chosen not to give detentions or suspensions or what have you. Law enforcement has not arrested or cited or fined anybody because they haven't followed the isolation or quarantine guidelines when Melissa has contacted those individuals and given them their dates for, this is when you can return to work or when you can resume your, social activities. That's kind of been universal, whether it's Lyon County or, anywhere in the state of Iowa. And so much like, individual schools in counties have made those decisions and chosen not to follow the guidelines from the Iowa Department of Public Health. This is the conversation we're having here. Do we want to do something different than public health's kind of authority or recommendations or guidelines for people in Lyon County?
No, there have been at least couple private schools in South Dakota that have stated that, okay, even if you're exposed, they still let those kids come to school and participate in sporting events and whatnot. They just have to wear a mask. So that's an option too, but that probably does not align with Lyon County Health's definition of quarantine.
Correct.
They collect a lot of data on this stuff, and I don't know if you know this either, Craig, but, quarantining obviously is a big aspect of this whole COVID thing, but for those that weren't showing any signs or symptoms when they quarantine, is there, maybe it's difficult, but how many of those actually got COVID?
Became a positive case.
Became a positive case out of that?
I don't have that data for you, I don't know what that.
Does
number
anybody
is.
keep that data, or?
There's information out there about asymptomatic spread, which happens. The challenge with it is if you're exposed, don't develop symptoms, don't test, then we don't know really what those numbers are. So is there data out there about it? Sure. How accurate is the data? It's questionable because there may be more asymptomatic spread than we think because people don't test.
But then there can
It's a
also
little
be
challenging.
more people that have had COVID and have the antibodies because they didn't have the symptoms. And so our 30 or 40%, because of those people that don't show the symptoms,
Is a lot higher.
is most likely higher.
It might be a little bit higher, but it's hard to go off of, make a decision based on a hunch or a guess.
I think I'm hearing everybody, right, from everybody we've heard from so far, there's an appetite to peel off the mask requirements, but we don't know how to handle the quarantine, right? It's because of the quarantining that someone handcuffed everybody. Is that a fair assessment?
I would say for the most part, yes.
Yeah, I don't know. I like to take a lot of things in first. There's really, I'm not sure how I feel about it. I guess I'd be interested in not changing things throughout the school year. I don't think that makes us hitch the wagon to what the recommendations are forever. I think it just continues on until the end of the school year and then throughout the summer, see what happens and make decisions based on that. I don't think, much like COVID virus, it's not gonna be gone when school's over. It's gonna be, what about this year and what about this coming year and what are situations that we're gonna have to do? It's probably something that we'll be dealing with for quite some time. There's probably people who got over polio or other diseases with immunity, and they were like, I remember we used to have the lineup to do that, and that's just a part of what it is right now. So I don't think the decision, if we make a decision, I don't think it's just, wow, we're gonna stick to what they're recommending till forever. I don't think that's the case. I think it's just another time to revisit it and wherever that looks into, and maybe it's another revisit on the other way if it goes the wrong other direction. So I guess I wouldn't be, you know, I'm open to discussion, but I don't know that I'm interested in changing anything at this point throughout the rest of the year. You know?
What would get you to that point of deciding to change, not to put you on the spot?
Sure. Well, I'd like to see the vaccination numbers higher, you know, personally. That'd be something that I think people
But not
could do.
everybody's gonna get vaccinated.
Pardon?
Not everybody's gonna get.
No, that's fair. And I would not make someone if they chose not to. I'm just, you asked me what my opinion was on what I'd like to see, so that's kind of what I'm going towards. So, you know, I would think you're looking at herd immunity. Folks are gonna have to get vaccinated like they do for flu and for all the other things that there's vaccinations for. People smarter than me have figured it out, and I'm not smart enough to try to think that I'm smarter than them to undo that personally. So, you know, that'd be something that I would like to see, but those are things I can't control, you know? So I can try to help reduce the spread. I think we've all agreed that from November till now, having something in place like this has reduced the spread. There's maybe a lower percentage of it now. There's more people vaccinated, there's more people who've had it. There are all of those sort of things that come into play. I think it's just a longer situation as far as playing it out. And would, you know, if nothing gets changed, I would certainly welcome to revisit this in July or August before the school year starts and look at it again and say, what's public health saying? Okay, well, let's not do that, or let's continue to do that, or whatever that looks like. I'm not saying end the conversation now. I'm just saying I don't know that I'm interested in changing things at this point.
One thing that I want to comment on too, since I was in the school visiting and observing and things today, is the sanitizing and the hand washing. At the lower levels, that is for sure being done. They are hand washing and they are sanitizing. And so that's for sure being done. At the high school, it's a little harder for me to know that, and plus they're older kids, so you don't tell them to do things or whatnot, but they are doing those things. So like those measures are in place, and those measures should stay in place. And another thing, and I kind of meant to say this earlier, but I guess I lost my train of thought, but noticing in the high school students are maybe not as compliant right now as we would like them to be, but they really were. My understanding is they really were until the last few weeks or a month. They really did do a good job. It's just harder now. And so and they're doing that for a lot of different reasons. And for us to just keep forcing that on them, I think is just a hard position for teachers and for them. But I do feel like our school is doing a good job with sanitizing from what I was able to witness and from what I know and was told. So, and I think it was mentioned by a number of people today that they feel like that really plays a good part, a major part in not spreading the virus. Just hand sanitizing when they leave, before lunch, after lunch, recess, after recess, leaving the classrooms, things like that. So they're doing that often. And for me, on your point, I don't know, we've got 18 days left of school, and we have a good relationship with our Lyon County Health Department, and I don't know if anything would change if we decided to not follow the quarantine guidelines. I don't know that for 18 days, I want to test that. When it comes to next school year, if things are the same, we've got low rates, and they're still recommending that and everything, I will definitely entertain it then and make a decision to understand that. And I think it'd be a very valid and a good point. But I think I'd like a few more months to see how things play out before I would make that move.
So by mentioning 18 days, then you're gonna put an expiration date on what we do tonight? Or we're gonna propose?
Well, I just say the 18 days because that's when school's out.
Okay.
And so I guess I don't know, I didn't really think about it in that terms.
For me, I
say-
think we revisit it this summer sometime before the start of next
Yeah.
school year and make a decision based on positivity rates, based on transmission rates, all that data, like you said, and make a decision at that point that makes sense going forward for that school year at that point.
Yeah,
Obviously, as Joel said too,
I
things
know.
can change. We make a decision, a different decision 2 weeks later.
I mean, after with the last day of school, it's just not an issue, you know, because
It
we
is
don't
right.
have students in
Summer
the school. Maybe there's some summer school things.
Baseball, softball.
Well, for the activities, those are outdoor too, I guess, so.
Let's do it.
Well, if public health has said, don't need to wear a mask outdoors, that would fall under those guidelines then, fair?
If you're vaccinated. But if the kids
Sure.
are vaccinated, then
Kids have
is it our
it-
stance that they're gonna have to wear a mask and then all summer until we revisit it?
Kids haven't worn masks during basketball or wrestling.
Yeah,
Because that exception is in here, is that during athletic activities, you don't
activity.
have to wear a mask. So during baseball season, softball season, golfing, I
Yeah.
would expect that they're not needing to wear a mask.
yeah.
Now, would the exception be when they're on a bus?
Yep, so we have, when you've traveled to whatever location, you're supposed to be wearing a mask, yes. Just like when kids are riding the bus to school in the morning, they're supposed to be wearing a mask if they can't socially distance.
So essentially where we're headed to here is, if I look at what the requirements are now versus what some of the thoughts are, it's that essentially gonna be wear a mask when you can't socially distance, but the common areas, the hallways, the lunch lines, since those don't have anything to do with the 15-minute quarantine criteria, then those would be out. Is that fair?
That's where I'm at.
That's where I'm at.
Okay. And is there a desire to put an expiration date on this, or is this gonna be indefinitely until we readdress it as a board? So there's two options there. You leave it on indefinitely and then we revisit it at the beginning of the school year, or we say it expires on such a date, and then if we have to, we come back and do the same thing again at the beginning of the school year.
Well, I think to this date, we have put everything in, I mean, all the requirements we put in place have been indefinite.
Right.
And to me, it would make sense to continue along those lines, because then it's like, we may get to a point, well, what did we have put an expiration date on, what didn't have an expiration date on? To me, it would make sense, or be cleaner at least, have everything be indefinite, and then we'll come back this summer, before the start of the next school year, and make a decision. Maybe we don't change anything, but at least revisit it at that point, again, based on the current information at the time, make a logical decision at that point. That's my opinion, at least.
Yeah, I would say the same thing.
All right, so I think we're at the point where we've had enough time, everybody's been able to discuss. So the way we're gonna handle this is encourage someone to make a motion and spell out exactly what it is, what you want.
Really slowly.
So then, do you want to have an all-encompassing motion, or peel it off layers at a time, so to speak?
We'll have an all-encompassing motion for whatever you want, okay? And then if
Okay.
someone seconds that, we'll then open it up to any potential amendments. In order to amendments to be voted on, they have to have a motion and a second. So that'll always transition back to the main motion on the table.
I'll start off a motion and I'm gonna go a complete 180 and we can peel it off like we said, but I'd like to consider making a motion to eliminate the requirement to wear a mask when unable to socially distance, and to eliminate contact tracing at the school, strongly encourage mask wearing.
Is there a second for that?
can I ask a question about the eliminate the contact tracing? How, logistically, how would you do that? That's my question.
Well, if county, I guess that would be up to county health, how they want to handle contact tracing.
So we would say we wouldn't do it within the four walls essentially
Within the four
at
walls.
school.
Correct.
So we would not
We would say,
cooperate with county health in terms of giving them information about who's been in close contact in the classrooms, et cetera? Is that where you're going with that?
That's where I'll go.
Do you have comments on that, Brent?
I just think it puts us in a difficult spot with public health. Just runs in contrary to what I think we should be doing, But if that's what the board would like to do, then we just won't, I'll instruct that to Brenda, that we won't be participating and have that conversation with Melissa as well.
Can I make a comment on that? I would just, the conversation about taking contact tracing away and the quarantining away, from a public health standpoint and from a health and healthcare standpoint, that's a very scary concept. You'd be taking away one of the most powerful tools to prevent the spread of a disease that we don't have a really good treatment for right now. That's a pandemic on a global scale. And that's very concerning if that's the road that you choose to go down.
So I'm gonna ask you a question now. So what information then do you know that some of the other counties don't know? Because there's so many other counties, two counties not contact tracing, other schools aren't contact tracing, And I'm not saying that the county has to eliminate contact tracing. They can still do their job and still do the contact tracing, but I don't know that that has to be a layer that we have to participate.
Well, you take away the ability for within the school to go, who was this person? If a person who has tested positive for COVID-19, you now take public health, you take their ability away to go, who is that person around? Who are they in close contact with? Who could they potentially have spread that disease to? And that's the the point of preventing the spread of the disease.
But does public health go into every business in the county and do that? Why just the school?
Why we do it in the school, I guess we're sort of their
And not
other
other
business.
And not every business out there. If we have to do the contact tracing, county health has taken the stance that we're gonna continue contact tracing, then every time somebody tests positive, how come they're not going into every business in the county and saying, who does he sit by, who does she sit by, who does she work closely to, where they work?
But they are asking the person that tested positive, who have you been in close contact with?
Correct,
And they could do the same thing here with the student and say, okay, who
Without
are
a
you
doubt.
in close contact
without a
with?
doubt.
And I don't know what more information Melissa is able to get from Jason, for example, than they get from just the student themselves. I don't know the answer to that question.
Because then it's putting it on our principals to go and say, well,
But then you're gonna
you
put
were
it
in
on the
close
student.
contact with this person, well, then everybody knows that, well, it was also in close contact with that person, but that person didn't have to quarantine.
But then you're gonna put it on that student to name names. On the student that tests positive, if Lyon County Health calls them and says, who are you in close contact with, then they have to name names, where if it's in the school,
Potentially.
then it kind of takes that pressure off of them, I feel.
Okay, so we had Scott's motion on the table. Is there a second? Okay, that motion fails for lack of second. Is there another motion?
I will make a motion to continue the mask requirement when unable to socially distance. Removing the requirement while in the hallways, lunch lines, and other common areas, and continuing with the exceptions listed in Brent's memo.
Sorry, I'm going out of line here, just thought of something that I wanted to bring up before that I had written down and lost my train of thought, I apologize. But when we started this whole process, we eliminated the lower grades without having to wear a mask mandate for. Is that a possibility that we can go back and say preschool through 4th grade, preschool through 6th grade? We don't have to wear a mask?
My intent would be is if somebody wants to bring that up, if the principals want to make an argument or say to us, hey, guys, I think this would make sense, or that would make sense, I'm certainly open to that. And that's kind of what I said before, is I'm open to peeling back pieces of it. To me, it makes sense to start with.
I guess I don't know how the whole procedure works, and now that you've made a motion, how we can continue to add and take away later.
Yep, we can through the amendment process.
Yeah, and I think that's what Andy's saying is with the amendments,
Right.
we can make those
So when
changes.
do we make those
Okay,
amendments?
as soon as we get a second. So
Okay.
the one thing I will add into that though is one of the main drivers of adding that preschool through 4th grade mask requirement was because of the quarantine issues, right?
Mhm.
We didn't have that in the return to learn plan that we authorized back in July. That was not in there, but it's something we added on just because of the quarantine issues.
The mask to mask.
Yeah, it's the same issue there. Okay, so we have Dave's motion.
I'll second.
Thank you. Didn't want to repeat that. So we
Can you
have,
repeat it so I know exactly what
Yes.
the motion was?
Yes. To continue the requirement for wearing a mask when unable to socially distance, which would eliminate the requirement to wear them in the hallways, et cetera, as listed in this, the second bullet, the bullet point under the main
Yep.
bullet point. Continue with the exceptions in Brent's memo. So essentially, my motion just gets rid of the bullet point of mask will be required, well, worn in hallways, or mask will be required to be worn in the hallways, lunch lines, and other common areas. To me, it makes sense to start with that, and then if we make amendments to say, okay, we're not gonna do in the lunchroom. Well, that's actually not a board even decision. That was not a board decision, that was an administrative decision to do those things. So to me, that's within Brent and the principal's authority to make that decision.
That they can go back to the lunchroom if they desire.
That's now.
That's not our decision tonight.
Yeah,
That's
yep,
all we're-
yep,
okay.
yep.
So let's see.
And if we want to make a different decision regarding preschool through 4th grade, for example, and not requiring them to wear masks at all, I think that's okay to add that on as an amendment, in my opinion.
what you've established at this point that's been motioned and seconded is essentially taking care of our quarantining issue,
Yes.
right? At all grade levels.
Yes.
Yep.
It still puts yes.
Yeah.
Assuming the mask to mask, and both parties are wearing a mask, you would not need to
When you can't
quarantine,
socially distance.
even if you're within 6 feet for more than 15 minutes.
Okay, so we have a motion and second on that. Are there any proposed amendments?
So we don't vote on that part of it yet?
We do not. No.
Okay.
So is there any appetite for, or any desire to reduce mask requirements in the lower elementary grades? To me, that's one area where possibly it makes sense. I don't think that there's much need to do anything beyond 5th or 6th grade probably, because they are able to socially distance. I don't know, Steve, you tell me, is there a benefit to reducing the mask requirement for preschool through whatever grade in elementary?
I know our classrooms all the way through, Jason, you talked about the other grades. I'm in charge of through 6th grade. We are socially distanced in all those classrooms, all the way through 6th.
Okay, so,
Brenda's worked with all those teachers to make sure that there's social distancing occurring.
okay, so the mask requirements is fairly minimal as a general rule. But as you mentioned before, okay, when you're in small groups or large groups, on a carpet time, those types of things, yes, okay, they're still wearing masks.
They have been, but they maybe,
Wouldn't have to.
as kind of an extra precaution that they're taking right now, because it sounds like most of those times are under the 15 minutes. So if it's just when unable to socially distance, even those carpet times, they maybe would not need to. The teacher would know the amount of time that they're spent there.
So that throws a twist into it.
Well, okay.
Right, and I
That's where the
understand.
difficulty continues to be,
You're right.
because, again, whatever study you wanna look at, I don't know if 15 minutes, you know, if, all we're worried about is quarantine, yeah, 15 minutes is valid, but I think if I'm a elementary kindergarten student and I'm sitting next to somebody on the carpet, and if I'm positive, the likelihood of me passing it on to somebody because I'm sitting next to them on the carpet, doesn't matter if it's, I breathed on them for 15 minutes or 5 minutes. And so that's, I guess, my argument for continuing it down to preschool, because we know that those kids are in those close proximity. They are working with a partner, you know,
But
they're
we've
doing
also
cooperative
only
learning.
haven't had an elementary case since February, and positivity rates were higher than what they are now.
I think we gotta be a little careful with that, Mr. Jorth, because we also are proposing taking away the hallway requirement.
Yeah.
And if there's a place where it's gonna spread, it's gonna spread in the hallway, right? Where kids conglomerating around lockers, that's where it's gonna happen. So I think that the discussion we've had is not necessarily anymore to stop the spread, it's to do what we can to keep from having kids deploy.
Because we feel like that spread is pretty much,
The risk is much less
is much
now.
less. It's not that we're
than it
not
was.
concerned about that, but that risk seems very, very minimal
Yes.
in the present time.
Right, but I'm just aligning that with,
Yeah.
it's the same, it doesn't matter what grade you are, if you're sitting on the carpet versus standing in the hallway talking to your senior girlfriend or whatnot, it's the same spreading mechanisms, if you will, so.
Good point.
Okay, so, are there any proposed amendments to the main motion that has been seconded?
I'll amend to eliminate for TK through,
Preschool.
or preschool through fourth grade.
Okay, so there's
Eliminate all mask requirements?
Yep.
Okay.
been a motion to eliminate all mask requirements for preschool through fourth grade. Is that correct? Is there a second for that?
So just point of understanding the process here, Andy. So if this gets seconded, does that become part of the main motion?
It goes to a vote at that point.
So
The amendment,
Just the
the
amendment.
amendment goes to a vote, and then if that passes, then it gets applied to the main motion.
Okay, so we vote on them separately. The amendment gets voted on separately from the main motion?
If there's a second. Yep.
Okay.
Yep. I know, it's a challenge, bear with me here.
No, it's a good process. I just want to make sure that we're all on the same page.
It's a process we don't use very often either, so.
No.
No, take as much time as we need. So is there a second to Mr. Postman's motion? Proposed amendment, I should say. Okay, that motion dies for lack of second, so we're back to the main question. I guess I'll ask one more time, are there any other amendments to the proposed question? Okay, so we're at that point where we have a motion and a second. Now I'll call the question for the vote. So we have a motion and second on the table to continue for students and staff grades preschool through 12 to required to wear a face covering when they're, or a face mask when they're unable to socially distance. The exceptions listed under Mr. Jorth's memo. Is that correct? Mr.
Yes.
Jennings?
Yes.
Okay. With that in mind, Mrs. Jorth, would you call the roll, please?
I don't know what to do for that.
Just say there, just go around the table.
Okay. Mr. Jans,
Aye.
Mr. Postma,
Nay.
Mr. DeWitt,
Nay.
Mrs. Davis,
Aye.
Mr. Coop,
Nay. So if I record that right, that motion failed.
correct.
Motion failed 2-3. Okay, so, Joel would you like to give some additional commentary there?
Well, I just would, I guess I would, to your point, I guess a little bit is, you could sneeze on someone walking by in the hallway, and that would, you know, that could easily cause something to happen, or something should have happened, so I guess, I'd be, you know, I'd like to keep it the way that it is to the end of the year, and address the rest of this, so I guess perhaps, I don't know. I guess that's kind of where I'm at, so I would support P through 12, all of that, I didn't want to get rid of the mask required in the hallways, that's kind of what I was thinking. If I was maybe I wasn't understanding it correctly, but maybe I was.
That's fair. Okay, so we need another motion to get through this then. Is that fair, Mr.
That's
Jordan?
correct, yep.
Correct. Can the same motion be brought up twice? Because what's your recommendation then, I guess? I'll make a motion, well, no, I'm not making that.
I feel like some said nay because they want the current mandate to stay in place, and I could be wrong, but some maybe want less mandate. Some want it just to stay, and some want it to be less.
That sounds like an accurate observation.
Yes.
Good, then I am understanding things correctly right now. And I guess if
So
the
as
same motion could have been brought up twice, I would have wanted to know that beforehand, so I'm hoping that that's maybe still a possibility.
That goes back to Robert's Rules of Orders.
I don't think the same motion can be made twice.
No.
There can be a reconsideration of a motion.
Does that require 2/3? You guys are gonna make me go out my cheat sheet, aren't you?
So what's the compromise? Is there any compromise in your eyes, Joel, between those two motions?
That's a good question.
Well, I'm asking.
Yeah, I know.
Between parliamentary?
I don't know.
Looks to me like main motion, resolution.
Yeah, I know it's been, I guess, to sort of talk at large a little bit, it's been, I'm sure, extremely difficult for teachers, and I don't want the teachers to be super focused on, oh, you gotta do this, you gotta do this, only worried about their masks. I think they need to be more worried about teaching. I guess from what I'm gathering, that it's okay as it is for now, and, you know, maybe if there was an overwhelming majority of people who just were super annoyed with it, I don't know, I guess that's.
There's 70% of the respondents that said they wanted
Sure.
to eliminate it.
Yeah.
So
Well,
Carrie,
really
based-
85%, because 16% just wanted to wait. You know, if you go with the 69%, for teachers anyways.
Right.
So Carrie, in your observation that you made today, it was primarily in the high school where the students were more challenged, I'll say, to wear masks in the hallways?
Yes, I would say that. To be fair,
It can
I
be.
didn't really notice, I wasn't at a time when students were in the elementary wearing a mask. They were in their classroom or at recess at that time, so I couldn't necessarily observe that. I could just observe in the classrooms, and I could see them on the carpets, they wore their masks. When their desks were socially distanced, they did not. So that knowledge comes from talking with Mr. Harmon, saying that he really, the elementary students and he can correct me if I am wrong, but he doesn't have, they comply. As it goes up a little bit in age in middle school, probably needs a few more reminders.
Yeah.
And it gets to high school levels, there's quite a few reminders.
Okay.
And I have a feeling that they just kind of listened to Mr. Engelman today, and that maybe sometimes it's a little more
It
hostile
may
a
carry
little
more
bit.
weight coming from Mr. Engelmann
And that's
versus
just my
from a
understanding.
teacher, maybe?
What?
Maybe it carries a little more weight coming from Mr. Engelmann than from a teacher?
Or para,
I don't
or
know.
whatnot, yeah, it definitely could.
He's got a.
But I don't know, that's,
Okay. Andy, what's
Okay,
that now?
yeah, so what we can do, we can have a motion to reconsider the main motion. That needs to come and be seconded by either you and Carrie, because you voted in the affirmative.
Okay.
So once that's through, if that gains support, then we can go back and debate the main motion again, and then eventually call for a vote of that again.
Okay. So I'll make a motion to reconsider
Okay.
the motion about our discussion
Okay.
for mask mandate, mask requirement.
and I'll second.
Okay, we have a motion and a second to reconsider the main motion. All in favor, say aye. Aye. All opposed? Motion carried. Okay, so we're back to the main motion, which we're gonna have to have another motion and a second on that.
Correct.
Is that right? Yep, okay,
Now we're just back to square one.
okay.
Yep.
So bluntly put, back to square one. So that's where we're at. I guess the question comes down to the hallway issue. Joel, is that something that you think that has to be in there?
But we don't need a majority, doesn't necessarily have to. Do we need a majority? We need a majority, but we don't need all five,
Correct.
right? Okay.
That would infer that Postma or I would change your vote.
Yeah.
That's correct. I don't mean to put you on the spot.
Sure.
Well, I say that because I don't want, Joel can believe what he wants to believe, and I completely respect that. And so I don't want anybody to feel forced to change what they feel in that regards, and
No, that's fair, but there's a process to it. Something's gonna have to be taken out of this moving forward. Yeah, like, I'm not sitting here until 8:30 or later, working this around. So there's gonna have to be some concession to some extent. I understand that, and yeah, it's something I can consider, that way. If I like it to stay in there, yes. If it doesn't, I would probably reconsider a little bit. Because I'm sure it's been, like I said, it's been difficult on teachers to be able to do that, and it might help continue to focus on learning, staying in the classroom and greeting kids when they come in versus standing out in the hallway and, hey, Isaiah, Hudson, whatever, to tell them that they need to continue to wear their mask or keep moving along, whatever that way, so.
I think, as you mentioned, Carrie, I think that's applaudable, letting us all have our position. But when the will of the board is kind of on the wall, I think the rest of us kind of see that, so.
So what is, for you two that voted nay, I understand Joel's position. What is it that you want to change?
I've
Also-
already made my case for that.
Because you want the no contact.
I'm okay. Leave it at that. So I'll ask for the motion again.
Okay, I'll make the motion to require masks to be worn by students and staff in grades preschool through 12 when unable to socially distance, with the exceptions listed in Mr. Jorth's memo, but not requiring them to be worn in hallways, lunch lines, and other common areas.
Is there a second?
Second.
We have a motion and a second. Any proposed amendments we have not covered already, please? Okay, we have a motion and second. Mrs. Jorth, please call the roll.
It was the same as the first one, right?
Yes.
Okay. Mr. Jans?
Aye.
Mr. Postma?
Nay.
Mr. DeWitt?
Aye.
Mrs. Davis?
Aye.
Mr. Koob?
Aye. And that motion passes 4-1. Okay, so we are on to item 7, announcements, dates to remember.
I didn't list them all here, but our next board meeting is on Monday, the 12th, I believe. Graduation the following Sunday. Tomorrow, we got our junior high track meet. Those would be the big ones. Last day of school for kids on the 21st, last day for teachers on Tuesday, the 25th.
Make a motion to adjourn.
Motion to adjourn, do I have a second? Second. Motion and second to adjourn, all in favor say aye. Aye. Opposed? Thank you, everybody, for attending. We are adjourned. So, we don't have any bills to sign or anything, right?
Doesn't have any
We can move right into the
work sessions.
I need to use the restroom.
Yep. Yep.
I knew how to call.
Where's Jackie?
Sydney has
Hip surgery.
hip surgery on Friday,
Oh, okay.
so
I had to
she,
do this the last time too.
um,
I've drawn the short
they're on their
straw.
way to Iowa City,
Oh, okay.
and so she's got a COVID test tomorrow, surgery on Friday, and then it's a pretty long road with recovery.
Oh,
So Sydney won't be back in school for the rest of the school year, so she'll have to basically distance learn.
sure.
And I think she said it's like a 6 or 8 week, depending on how everything comes out,
Oh, wow.
kind of reduced mobility.
Who's doing that?
Sydney,
She a junior or senior?
And she's doing junior.
yep. I think it's like, it's called dancer's hip.
So they have to replace her hip?
It's not a hip replacement, it's like a realignment.
Oh,
I don't think there's anything artificial going in.
okay.
Is she a junior or senior?
Junior.
Rowing.
Rolling, feeding too much?
Yeah.
Yeah, unfortunately, her dance career is
Southeast.
come to an end and she's not playing golf right now.
Sure.
So
Yeah.
Oh, we got that.